Today I have with me the Public Relations Officer of the Sanitation Service Authority, Mr. Carl Padmore. Thank you so much for joining me, sir, and I look forward to having a productive conversation with you.
No problem, Kobe. No problem.
Yeah, we're just going to talk briefly about the garbage situation in Barbados. We know that the Sanitation Service Authority has been hailed as a very essential service, and you guys would have had a clap and a little ceremony for them. I just want to find out from you now, with the situation with the curfew, has it had an impact on your operations, or has everything been going fine?
The curfew has not hampered because we are frontline. What it has brought to the surface, we are still seeing pockets of persons disposing the waste loosely in the cans. When we are encouraging them, as we did before, to bag it and seal the waste, especially during COVID, where you might have tissues that you would use and different things. We want to remind Barbadians to bag and to seal the bags. The other challenge that we're faced with is one where persons are having their vehicles in the road as we're passing. They park their vehicles when they could have the vehicles in their garages off the roads, especially in the small Bridgetown areas. Persons are trying to sneak bags of garden waste into the mainstream. And while we use our discretion in removing some of the bags, we still want Barbadians to be mindful that really garden waste should be placed in a compost or taken. You could take it straight to the landfill. There's no tipping fee. So there's some small issues. There is a reduction in the waste from a particular sector. You had a large percentage of the waste coming from the hotels. You had a large coming from nursing homes. That has been reduced, right? That would have been coming in from the private haulers. So you do not have that because, as you know, the hotels are closed, the villas and that. You will see a reduction, but you're not going to see a reduction in the domestic waste, the house-to-house waste at all.
And I know that following the Sanitation Service Authority's Facebook page, we would have seen a couple of weeks ago that you guys would have made a plea because there was a situation where people were putting feces into the collection. How has that been affecting your workers, and have you seen a reduction in that type of occurrence since your public notice?
It raised its head on one other occasion. It has reduced a bit, but it's still concerned because that's bodily fluids. And we would want to urge members of the public not to do that. Now, all bodily fluids really should be disposed in the incinerator at the Queen Elizabeth Hospital. All needles, for instance, should be placed in a sealed bottle and taken to the nearest polyclinic or to the hospital. From time to time, up to today, you had pieces of broken tiles in the north of the island in a bag, and we had to take that young man to get medical treatment. He's now on sick leave.
Have you also seen a reduction in the amount of illegal dumping, or has that remained consistent?
We're still seeing pockets of that. The coconut vendors, we're still finding that they're going and disposing of the coconut shells in gullies and in cart roads. You're still seeing lots of bulk waste, like what we call the white goods, the fridge, the stove, still up there. So we really want to urge Barbadians to understand that it takes $30 million to build a landfill. Therefore, we want them to get into recycling and sorting. The more that they dump illegally, we have to take it and sort it. The more garbage you generate in your house, is more garbage going into the landfill. But if you separate at source and get into plastics, metals, bottles, paper, white goods separate, then we are reducing the load going into the landfill. And this is what we are preaching. And this is what, to us, is the answer. Because less waste into the landfill is less money that we have to find to build a new landfill.
And any tips for Barbadians as they are at home, and they're still at home for the most part? What would be your public urge or your public call for Barbadians to do as we continue to be in this situation with COVID-19 and even coming out of COVID-19?
As Barbadians, we need to know the difference between cleaning a surface or cleaning yourself and sanitizing. When you clean, you are just removing the dirt and the grime, which you can do with just water. When you sanitize, let's look at the bin for instance. After you wash that bin, after the garbage has been removed with the hose and the water from the hose, then you would get a sanitizer, which could be Clorox, which could be just food, and you sanitize it. That's something different. So some people sometimes go straight for the sanitizer, but even with your hands, you need to wash your hands properly first. So you need to wash the bins carefully. We know that you have a good relationship with your sanitation crew, but observe the social distance, the physical distance. That's important for us as well. That's why we're preaching bag and seal the waste. Let us come then into the bin for the waste. It's the law in the Health Services Act that every dwelling house should have a suitable receptacle. So we're urging Barbadians to get a can or a suitable receptacle so then that we can come and remove the waste in a safe environment. Yes.
Okay. Thank you so much for the work that you and the members of the Sanitation Service Authority do on a daily basis. And I do hope that your job is made easier with some of these tips that you would have provided to Barbadians.
Thank you, Kobe. And we want to help you. So help us to help you better Barbados. And we're fighting and aiming towards a COVID-free Barbados. Blessings.